Hello. So, my name is Cassandra. I go by Cassie. Um, I chose to become a nurse. It wasn't really an easy or quick decision. Um, my oldest is 15, and when I had her, I always thought that if I could just snap my fingers and be in any profession, that I would become a labor and delivery nurse because the one that I had with her was a godsend. A lot of people have that story where they feel inspired. But my issue was I was always petrified of needles. I would, you know, be a fainting risk. So I didn't pursue it or anything really. And then um, about 3 years ago, I kind of had this epiphany where I realized that I am capable of doing anything, and if I want to learn to play an instrument, like, you don't just start out good. It takes time and practice and learning. And so I decided I want to do something with my life. So I enrolled in school, and I initially had the thought of becoming a ultrasound technician because I thought that way I could be close to women having babies and not do anything with needles. Um, so I did my first math class, and then after that, I met with the advisor, and I asked her what my odds were of getting into the sonography program. She told me they weren't very high, that everyone who gets in has straight A's all throughout their prereqs, and they have at least 550 hours of patient care experience, and I had none. I left that meeting pretty upset. And then talking to friends, one of them advised me to get my CNA license and get a job at the hospital. So I just went ahead and did that. And then while I was working at the hospital, I found it was a great opportunity to be able to talk to everybody in all the professions. There's, physical therapy, occupational therapy, respiratory therapy, nurses, the list goes on and on. And within talking to a bunch of people about their job and how they like it and stuff, I ended up deciding that nursing was for me. I just had to get over my fear of needles. So I intentionally watched every single IV insert that I could. It started out where I couldn't watch and I had to watch the TV because I felt like I was going to faint. And over the last 2 years, I really desensitized to it, and I'm feeling a lot better in that regard. I was still going for labor and delivery until the day came where I got to take some breast milk from one of our patients down to the NICU. And in there, just my bucket was filled that day. And I've had a few other opportunities to go in there, and I've talked to the nurses and the nurse manager, and I really feel like that's where my heart is and that's where I want to go. So my intention is to do the LPN and then bridge over as soon as I can, and hopefully be working in the NICU. And then when my kids are grown and gone, I want to be a travel nurse. So that's also my experience in the healthcare field, as I've been working at TG and Good Sam a little bit, but mostly TG for a little over 2 years now. 3 items that are special to me. I had a really hard time finding anything that's special to me, so I'll show pictures. There's a picture of my husband and I on our wedding day. He's special to me, And then here is our youngest. His name is Elias. He's 4 years old. And then this is a really old picture of my older two. Right now she's 15 and he's now 11, but I just like this picture because they were so cute. And then our dogs that we had, this was Jack. He was my husband's when we came together. He lived to be 21 years old. He was old and full of hate, and he was wonderful. And then this was our Odin. We just lost him to lymphoma in August, so we're still grieving that and having a hard time with that. But the pictures I have, my shelf back there is what holds all my pictures. And so I guess my family is what's important to me. I guess that's all I have to say. Bye.